Hi, I'm Dr. Melanie RIchardson, and I'm talking to you here from Balance Vitality Wellness Center. I'd like to talk to you about something today that many people are beginning to experience, but isn't common, and Western medicine doesn't know what to do with this, and that's eustachian tube dysfunction. We've all heard of children getting chronic ear infections or having plugged ears due to allergies, and this is something that has usually been seen as a childhood disease, but more and more adults are getting eustachian tube dysfunction, and that can feel like having a chronically clogged ear, or it could even be just your tympanum being very sensitive to sounds and almost vibrating too much in an irritating way. Western medicine doesn't have much it can do for this. It may give you some antibiotics, it will insist on antihistamines, and adults may be offered eustachian tubes like you'd get from a child where they create some drainage in there. But what can you do that maybe gives you a little better relief without all the invasive techniques? Breathe. The interesting thing about our breathing process is that we process 4 different types of gas: oxygen, carbon dioxide, nitric oxide, and hydrogen sulfide. And the one we're interested in right now is the nitric oxide. This little bit of gas changes how our blood vessels contract or release, our bronchial tubes contract or release, and has a lot to do with how the inflammation plays out in our sinuses. And since our sinuses are all through here and they come back, they also connect to that eustachian tube. So when someone's dealing with eustachian tube dysfunction, they can go ahead and take a deep breath and try to go through the pattern of the Western medicine, or you can try the technique I'm going to recommend today, which is based on Buteyko breathing. Zhang et al. In 2019 discovered that Buteyko breathing methods are very effective for relieving eustachian tube dysfunctions, no matter how the symptoms show for you. So what you're going to do is you're going to take a little breath in, release it, fully exhale, and then hold your breath for 5 seconds. Softly inhale again, and repeat. So if you have a breathing disorder, if you have really congested sinuses, deviated septum, you may find it more comfortable to start to work in smaller increments. But as we hold our breath, we do a few different things. We are changing the amount of oxygen that's available. We're absorbing the amount of carbon dioxide that's available, which actually makes our oxygen metabolism more effective. And we're allowing the nitric oxide to continue circulating in these local tissues while we're holding our breath, relieving that congestion and that full feeling. So, if you suffer from any eustachian tube problems or you have an adult friend that is dealing with, ask them to give this a try. Thank you.